Today I'll be demonstrating the radial and anti-radial scanning technique. I'm going to start off with the radial technique. This technique is carried out by having the marker of the transducer pointing towards the nipple at 12 o'clock and the transducer being on the inner breast. I then move the transducer radially, but always have the marker pointing towards the nipple. As I move through the scan, I continue to change my probe grip to ensure that good ergonomics are carried out. This survey ensures the tissue surrounding the nipple is imaged. After this survey is completed, I place my transducer on the outer breast in 12 o'clock with a marker facing towards the nipple once more. There is overlapping between the inner and outer breast to ensure that all breast tissue is imaged. I repeat the radial survey for the outer breast. In a clinical setting, I would perform two surveys of the inner and outer breast, as one would be for contour and the other would be for content. I'm now moving on to the anti-radial survey of the breast. To start off with, the transducer will be in the transverse plane at 12 o'clock at the superior portion of the breast. I'll then slide inferiorly until I reach the nipple. I'll then move back superiorly to the starting point. I'll then move radially slightly until I reach about 1 o'clock and repeat this process. At about 3 o'clock, I change the transducer position so that the marker is always pointing towards the patient's right. At about 9 o'clock, the transducer position will need to be altered again so that the marker is still facing to the right side of the patient. The anti-radial survey would be repeated for a second time in a clinical setting, but as this is a demonstration, I'll only be doing it once, and I also move the transducer a lot faster than I would in a clinical setting.